Hi everyone, thank you so much and welcome back to my YouTube channel. My name is Roselle Roth and I'm a nurse here in Las Vegas. I miss you guys so much. I miss talking to myself, because when you do video you talk to yourself, right? But I love giving out an information. I love beauty, I love makeup, this is like a hobby to me. But I hope everyone is doing well, and for today's video guys, I want to talk to you guys about how to prevent or spread the transmission of coronavirus, and I want to talk to you guys a little bit about typhoid fever. So the first thing that I want to talk about is how to prevent or minimize the transmission of coronavirus. We all know that we are going through a pandemic. It's been 6 months now, I believe. So it's quite a bit. It's quite depressing that our town has to close, and it's actually depressing, but we are all in this together and we're gonna move forward. Actually, by the way, hi to my friends and to my coworkers, my family and friends back home. Hello to you guys. So first guys, what's the number one prevention or to minimize this virus? I would say hand washing. A good hand washing technique, 20 seconds, make sure that you lather your hands in between and your nails, and make sure that I recommend short nails, because if you have long nails, the truth is it can harbor bacteria, so it's like a breeding ground for bacteria. So that's why I'm a nurse, so I never have long nails. See, my nails are so short because I don't like long nails. Anyway guys, hand washing is actually the most important part of minimizing or prevention of the coronavirus. Yes. Number two would be social distancing. Yes, we have been doing social distancing because everything is closed here. We just opened like maybe 3 weeks ago in Las Vegas. But the thing of that is that we also have to live our life, right? We have a life. We have a job to do. We have bills to pay. We can't keep everything closed. So it's really sad, but we have to do what we have to do in order for the sake of ourselves, of our community. So anyway guys, so social distancing, make sure that you stay 6 feet apart and wear a mask when you are in public. When I'm at work, I always wear a mask, of course. But that's the best thing that you can do. I mean, they're still trying to find a vaccine for it. There's no vaccine for it yet. Until then, we must do our duty to help eradicate the virus. But the thing guys is that the virus is actually, it goes through your nose. Those are the one portal of entry, your mouth, your nose, because then they travel into your trachea, going down into your lungs, and into the lungs, that's where they replicate thousands and thousands and millions of the virus, and they crowd your lungs out. That's why you feel short of breath. You can't breathe, right? It's hard for you to breathe. It's because of the virus that is replicating inside your lungs. So it is very, very, it's scary. So the people that are at risk the most, very, very sad, is the people that has underlying conditions such as COPD, chronic COPD, chronic obstructive pulmonary disease, asthma. So if you have asthma, yes, you are also at high risk because you already have that lung problem, you know, and if you have the coronavirus, it's gonna make it, it will exacerbate the problem, exacerbate your breathing issues. So that is why. And other health conditions, yes, hypertension, diabetes, all this type of things, obesity, and also most importantly, the the elderly population are very, very high risk because they have, you know, they're old and they have low immunity to the virus. Also, I want to mention the people that has autoimmune disease and cancer patients, of course. So just be careful if you have those what I mentioned. Just be safe. Maybe it's safe for you to stay home if you have all those underlying conditions, because it's gonna just make it work. It's gonna make it contribute to the problem, to your conditions, right? So just make sure that you don't go out if you have those. Really, really sad, but you already know the symptoms. I'm sure every one of us knows already the signs and symptoms of coronavirus, right? It varies from mild to moderate. Some people experience headache, severe headache. Some people experience nausea and vomiting, diarrhea. Yeah, it varies how, I think it varies how your immune system can handle it. And so that's why some of them, the most vulnerable population, the elderly and the people that are already sick, so they get the worst symptom, the worst sign, which is, you know, chest pain, short of breath, trouble breathing, and then they go into respiratory arrest, which is very, very scary and sad. But yeah, mild to moderate, like I mentioned, nausea, vomiting, diarrhea, headache is one of the symptoms as well. Some people that I know, they lost their sense of smell, sense of taste. So it varies, like I said. I am very, very lucky that I think I have a good immune system because I've dealt with coronavirus patients in my other workplace. But I got tested twice and I'm okay, I'm healthy. But we also have PPE. We have the proper PPE as long as you follow the protocol and how to use it. So you should be safe. You should be good. But yeah, it is very, very, it's very, very tricky, guys. So just make sure, because what it is the virus. Actually, when you contract the virus, you don't show symptoms for 14 days. That's what they call the incubation period. That, you know, they already contracted the virus, but you're not gonna show symptoms right away after 14 days. So that's what it is, very, very contagious because of that 14-day period, because you're not gonna know if you carry it or I carry it, you know. So yeah, just be careful, be aware, and that's all you can do. Actually, eat healthy foods, get enough sleep, drink plenty of water. What else? Take your vitamins. I've actually been taking vitamins. I've never taken vitamins before this pandemic happens. But when this pandemic happens, it made me realize, okay, let me see. But I've been taking multivitamin, vitamin C and zinc. My doctor actually advised me to take it. So make sure that you go to your doctor first before you take anything. Make sure that your doctor knows what you're taking so that, you know, everything is good. So anyway, guys, and the next topic that I want to talk to you guys about is about typhoid fever. So for the reason we want to talk about this, because this is very prevalent in the third world countries such as the Philippines, my home country, by the way. So the reason why I'm tackling this issue, because my uncle died from, he was diagnosed with a typhoid fever. So suddenly one time in the middle of the pandemic, he was just like confused. The first symptom was confusion. Well, yes, any type of infection, take note that the person will get will get confused. That is usually the first type. But in the Philippines, sometimes confusion or hallucination, we we perceive it as being crazy. I don't know, but that's just how it is. That's why I wanna spread the word that it's not. In science, confusion and hallucinations sometimes we have to rule out infection, not necessarily your mind that you're going crazy, not necessarily, and you have to make sure that you rule out everything first before you do the psychiatric part. But yeah, my uncle was confused actually for a few days, and then he went to the doctor. My family back home took him to the doctor, and the doctor said that he had a, what did they say they have? He had a gastric ulcers, which I didn't buy it because I have gastric ulcers, and you don't get confused when you have gastric ulcers. Usually confusion is the number one symptom sign of a underlying infection that you have in your body. So just take note about that, guys. Don't underestimate any type of confusion. And so anyway, he went home, and after a few days he just suddenly got worse. They took him back to the hospital, and it just really progressively got worse. They put him on IV antibiotics. They tested him, and they said that he had a typhoid fever, which typhoid fever, guys, is a bacterial infection that you can get through contaminated food and water. So just watch out. I don't know, because I'm not there, so I don't know what he's been eating, if it's sanitized, or especially when you prepare your food, make sure that you hand wash first. You know, hand washing is the key. So just why I'm bringing this up, because I want everyone to be educated, especially back home. My fellow Oslobanans, my fellow community, that make sure that they know, they're aware where they can get that typhoid fever from. Bacterial infection, guys, and it's Salmonella typhi, the name of the bacteria that causes that type of infection. So what are the symptoms? Of course, I want to tell you guys, the symptoms would be high fever, stomach pain, confusion, of course, number one, and then belly pain, like I said, stomach pain. Those are the actually major symptoms of the typhoid fever: confusion, stomach pain, sometimes nausea and vomiting, but mostly belly pain and confusion and high fever. And yeah, my uncle had all of those. He was actually exhibiting all of that infection, but it was already too late. That when he got to the hospital, it was too late, and he died after a few days. They were gonna transfer him to like a big city, in the city hospital, Cebu City, but they could not accept him because of the overwhelming COVID patients in that city. But yeah, so I hope that you guys learned something from this, because typhoid fever, it actually can be treated if it is caught early, but it is also dangerous, and it can be fatal if it is not treated early. So just watch out, guys. So I hope that you guys learned something from this. From me, leave me a comment down below and click the notification bell. Please subscribe to my channel, I would really appreciate it. And please subscribe if you haven't already. I would really love it if you're part of my family. Anyway, thank you guys so much, and don't hesitate to leave me a comment down below, ask questions. I will get back to you guys as much as possible and as soon as I can. And I would love to see you guys in my next video. Thank you guys so much.